Hi everybody, my name's Michelle Vassallo and I'm from Rhythm Massage Development and Education. What we're going to be looking at in this episode of Connect is a practical way to get you ready to massage every morning or every afternoon whenever you start work. And what I'm going to show you is a series of little dynamic exercises. It'll take you about 3 to 5 minutes and it will warm up your whole body to get you into the massage room. Even when I'm not massaging, this is something that I get up and do every single morning. Gets my heart rate up, gets every single joint in my body mobile and ready to move, and it just helps me to move into the day feeling a lot more physically comfortable than I would if I went straight in to do any kind of massage without warming up. You can even stand outside your door of your clinic room and run through this little routine. I've shown lots of people in my classes this routine, but it's finally time to take it out to the wider community of massage therapists. So this is what it looks like. The first thing that we need to do is we need to get our fingers warmed up to do the work. This is where it's all happening. So we need to make sure that about for 30 seconds to a minute, we're running our hands through all their range of motion. We want to get our fingers ready to work. Sometimes in the morning they're really cold, let's get our hands going. After 30 seconds to a minute, the second thing that we want to do is get our wrists involved. So we bring our elbows together and our forearms together, lace your fingers together and run through a series of figure eights in one direction for 10. And you'll know that you're doing it right if your arms are rubbing up and down each other, and then change direction. Don't forget to change direction because we want to make sure that our wrists are ready to move in both directions. After we've done our hands and our wrists, we're going to move on to our heads. And the thing that we might want to take a note of is we're going to draw a circle with our heads. We're just going to take our head without tipping it back and we're going to rotate in one direction for 6 to 8 rotations. 10 if you want to make one figure to make it easy for yourself, and then go back the other way for 10. And what you'll hear in the beginning is a whole lot of creaking. But if you do this every day, that creaking will start to disappear and you'll start to notice that you've got a lot more mobility in your neck. All right, shoulders. What are we going to do about our shoulders? The first thing that we're going to do is roll them back for 10 because we want to make sure that they're ready to work as well. So lift and roll, lift and roll. Keep your core contracted the whole time that you're doing this. Lock your knees if you can and give yourself a really solid space to work from. Secondly, roll the shoulders forward. I always find this one a little bit more challenging. Keep your hands down by your sides and just feel the hands up and down the outside or the lateral sides of your leg. So we've done our fingers, our wrists, our neck and our shoulders. What's the next thing that we want to do? Well, a little bit of lymphatic opening or thoracic opening, but this is also going to warm up our arms, and this is a dynamic exercise. Up in opposite directions for 10. Making sure that you swing to end of range without going too much further than that and come back in. And keep it dynamic. Keep the core contracted again. The other thing that we can do for our shoulders, and this always gets a big laugh in the classroom because everyone looks like they're swimming, particularly the people who try to do breaststroke or backstroke. Both arms up. One arm goes forward, one arm goes back. So we swing through for 10. If you want to make sure that we're meeting our hands at the top, keep swinging through, and once you get to 10, reverse direction. Give the shoulders a workout, a dynamic routine before you start to work. 8, 9, 10. At this point, and this is something that I'll sometimes throw in if my elbows are feeling a bit stiff, arms out to the side, rotate backwards for 10, and then bring it back the other way towards you for 10. And that's got your heart rate up, that's got your shoulders ready to work, your elbows, your neck, your hands and your wrists. Where do we move to now? Hips. What do we want to do? We want to get our hips moving. Because how many of us have got really stiff hips? This can be done with the feet slightly apart, a little bit more even if you want to. Swing, range of motion all the way through. And then reverse. So 10 in one direction and 10 in the other. And if you've got a hula hoop, get the hula hoop on and give your hips a bit of a workout. Really important. We need to work from a strong base. And often we'll feel how tight our glutes are as we work through. The other thing, a bit of a torso swing. So one arm up, one arm down, contract your core, swing from side to side, making sure to swing all the way through so that we get some movement in our spine all the way along. All right, coming down to the end or the end of the routine, we're moving down to the lower body. We've done our hips, we've done our rotations. What we want to do now is our knees. My knees tend to crack a lot in the massage room, so the best thing I can do for myself before I get in there is to warm them up. Hands on the knees, forwards and backwards for 10. If you're so inclined and the knees will take it, side to side for 10, bouncing through. Keep the core contracted, not folded over from the back. Keep the back straight. The other thing, circles. If your knees are able to do this, this is a great way to warm up the upper legs as well, those big muscle groups, the quads and the hammies, one way and then 10 through the other. And then we're almost there. We've just got to rotate our ankles and do some leg lifts. All right, so the ankles, rotate for 10 in one direction and then go back and rotate the other way. Make sure that you do both ankles and make sure that you keep the core contracted so that you can keep your balance. Swap to the other leg. We go for 10 in one direction and then we reverse in the other direction. Hearing the click through the ankles, that makes our feet and our ankles ready to work. And the final part of this exercise routine, it's taken longer than 3 minutes, but once you've got it down, you'll have it in 3 minutes. Leg raises. The leg raises are used as a way to make sure that we're getting our hips ready to work, but also a little bit of aerobic activity. So what I normally do is I point my toe and I'll raise for 10 in one direction. And then I also will work the backwards. So I'll just show you what I mean. Going from here, backwards for 10. Lift as high as you can. Get that glute really working. And I do that on both legs. And the final move of this routine, and these pants are not really built for it, but we're going to give it a go anyway, is lifting the right leg out to the side. So for 1, 2, contract your core, point the toes, 5, 6, 7, 8, 9, 10. And that's the end of our exercise routine. Fantastic to show it to you. Work out how to do it. Have a look, write it down, see what sort of time frame you can get it into, and then make a commitment every day to take 3 minutes to do that, and that'll get you ready to work in the profession that you love. Thanks everybody. Bye.
Hi there, I'm James. I'm a business coach for massage therapists with Massage Champions, and today I'm going to talk to you about what I call homeostasis of the mind. Now, this is something that I talk about with a lot of our clients because when people come on board and start doing business coaching, they start making change in parts of their life. And it can be things that they're doing in business, it can be a whole lot of extra activity, and then of course as they go forward, they usually start seeing a whole lot more clients and a lot more of their time is taken up with that. And as massage therapists, you know what homeostasis is. Homeostasis in your body is where if something moves, if something's a little bit out of balance, somewhere else in your body kicks into effect to make it all line up still centrally so that everything is still in balance, even if it's a different type of balance to what it was before or what you might want. And the same thing happens in your mind when you start making change in your life, in your business. And what people will find is, hey, I'm having this explosive growth in my business. Everything's going really, really well. But all of a sudden, I'm finding I don't have the time for my family that I used to, or I don't have the time to write notes that I used to, or I'm just not getting out and networking with other health professionals or my friends like I used to. And this is the homeostasis effect happening in your mind and in your life. When a big change happens in one place, you have to be aware that that is going to cause the equivalent changes to happen somewhere else so that your life and your mind will still be in balance. Now, if it's all controlled and you're expecting this to happen, it can still be an absolutely fantastic thing to take place. It's like, yeah, I want more clients, so I am willing to give give up those mornings watching daytime TV in order to make that happen. That's absolutely fine. But if you're already busy, if you've already got a life that's filled with things, you have to be able to expect that when I make changes and I'm starting to see more clients, or I'm growing my business in other ways and putting my time and energy into this place, it is going to mean that time and energy is drawn out of somewhere else. And as long as you know that that's going to happen and you can plan for it and allow it to happen and choose the right places you want to draw energy from to put over here, then everything's fine. But if it's unplanned and unexpected, it can suddenly draw out of places that after a little while you're like, hang on, I don't want this life anymore. And subconsciously, our mind can then shut down that business stuff to be able to draw energy back to those other places that it's being taken away from. So what we want to do is make sure that you know what's going to happen when you grow your business. You're expecting it and you're allowing that time and energy to be drawn out of other places. It could be sacrificing something that you like and enjoy, but for that bigger purpose. Or maybe it's just drawing out of things that you are happy for that energy to come from. But whatever it is, remember, homeostasis means that your mind and your life will stay in balance in one way or another. And we want to make sure that by choosing it, you are empowered to make it feel as good as it can be.
Hello, I'm Niki Munk. I'm at Indiana University. I'm an assistant professor in health sciences, and I joined ARCCIM about 2 years ago as part of the CM group. I am the Massage Myotherapy Australia Fellow, and I'm really excited to be a part of this group because it gives a platform to massage therapy at an international level within complementary integrative medicine. That there's not a whole lot of researchers that are practitioners that are around, and so to be a representative and to be a part of that is a great honor, and to be able to collaborate with the many other fellows and the great work that they're doing has been a great privilege.
So currently at the moment, Dave, I'm sort of working in private practice, sort of based around sort of Coburg East area, and I'm also lecturing at VU Polytechnic at West Footscray in the Diploma Remedial Massage and the Advanced Diploma of Myotherapy program. So that's what I'm really focusing on at the moment, and it's quite nice to have the teaching and the sort of the clinic that goes together quite well. I like sort of passing my knowledge on to students and sort of teach them how to assess and treat clients very accurately and precisely, and not to assume things. I like sort of guiding them through their stepping stones, just in helping them with their techniques and their own sort of body awareness, so they don't wear out too quickly. So I quite enjoy teaching. I've been teaching for a long time now, probably over 15 years, sort of at various different sort of institutes. Some days are quite testing, like all jobs, but some days are very rewarding as well, and it's nice to have the teaching and the clinical background that go together really, really well. So I try and pass my clinical background on to my students when I teach them. Just have to remember sometimes courses are just at a particular level to start with, so not to pitch it too high or anything. Yeah. The main subjects I'm sort of teaching at the moment is clinical assessment and client evaluation. So that's just assessing the client with their active, passive, resisted and special testing, etc. and working out their DDs and a treatment plan, and then how to implement that treatment plan. Teach them also corrective stretching principles as well for specific conditions, and also teach remedial massage techniques. That's just a whole different bunch of modalities that we treat when we treat particular soft tissue areas, whether it's trigger point, myofascia, MET, PNF, around that sort of lines, cupping, etc. So the main subjects I sort of focus on at the moment, and with the myotherapists I focus on clinical assessment and treatment once again for the myos, and how to put a treatment plan together and then to implement that treatment plan for their condition. And we do a few more exercises with them too, a bit more specific for conditions. So my background, I sort of started off with sports science back in 1994 in Auckland. Didn't really know what I wanted to do, but wanted to know that I want to be in the fitness sort of health scene. Because I was training quite actively back then too, and doing some personal training. So I did a diploma in applied sports studies, which I found really a good starting point. It sort of got me in a direction where I wanted to go. and that focused on the exercise physiology side of things. And then I ran a personal training business for a couple of years in Melbourne. Really enjoyed that, but then started to see clients with more specific injuries or complaints that I wasn't really able to deal with because I didn't really have that background knowledge. So that made me think I actually quite want to go down that road and learn more. So once I went overseas and did a bit of a working holiday overseas, I came back and applied to do myotherapy at RMIT. That was 3 years full time, and I really enjoyed that course. That taught me a lot about soft tissue and the dry needling principles too. And it was a needling that was a big attraction for me to go into the course. From there, I did some postgraduate studies in musculoskeletal pain management, a postgraduate certificate at RMIT, and that was really quite useful. That went really well with the myotherapy, and it was more to do with differential diagnoses and how to treat different conditions. And then I just worked for a number of years, carried on working in clinical practice for a number of years, because I've been in clinical practice for over 15 years. And then just recently I did some postgrad studies in the McKenzie method through the McKenzie Institute of Australia, and that was 1 year. And that's based on 4 separate courses spread out through the year, sort of part A, B, C, D, and then you can choose to do those all in 1 year, or you can carry them over a number of years. I chose to do them all in 1 year, and then sit the credentialing examination at the end of the year to be officially credentialed as a McKenzie therapist, which is quite a nice goal to achieve, because there's not many of us. There's probably about 160 or 165 of us in the country that are credentialed. There's a lot of work and commitment, but I really enjoyed it. I had a lot of study groups, studying every day of the week, practical groups twice a week. It was well worth it though. I learned a lot of fantastic information, and I still learn the course. But I think that's been very valuable to add to the clinical practice. So when you put myotherapy with McKenzie method, I think it's a very strong combination, because you've got myotherapy that focuses on soft tissue modalities and fascia, and also joint and nervous system. And you've got the McKenzie method that really focuses on, the spine and the extremities, joint issues, nerve issues, etc. So it's a really nice complement. So I found putting those two together, not only with assessment and treatment, has been really valuable for the client, and really valuable for good outcomes at the end of the day too. Yeah, so I'm really enjoying the two together. Yeah, it's nice to do something a little bit different too. As you know, with myotherapy, we do stuff with joints, but we don't go into a great depth of those joints. But with the McKenzie stuff, you do, which is really good, and we learn techniques that I haven't sort of come across before, but really good techniques, and everything's really evidence-based research, which is really valuable. No guesswork. Let's prove it. Yeah. At the moment, I'm actually getting around lower back pain clients coming in with radicular signs and symptoms down the leg as well. So I've been dealing with a lot of lower back issues the last couple of weeks, but I also do see a lot of other regions coming as well. But just recently, a lot of backs. So I'm seeing a lot of disc problems at the moment. We've got some subtle disc problems where it's just local discomfort and can radiate into the glute area. And then we've got other issues that are a bit more complex, where we've got discomfort and altered sensation sort of going down the leg and below the knee. So I'm dealing with a lot of those at the moment, but getting really good results. So I use my McKenzie method, which is mechanical diagnostic therapy, in my testing protocols, and also implement these strategies in my treatment protocols, then retest the clients to see, are we moving with less pain, and are we achieving those full range of motion that we need to get to without pain or discomfort. And then once I've established that, and I don't rush through that, I take my time to establish that, then I implement the myotherapy sort of side of things to it to elongate fascia and soft tissue to try and take load off those joints. But I don't implement that until I know exactly, have a very, very good idea of what's going on with that client on day one. So it's a nice combination to see. And they're responding really well just to the basic sort of movement. So I'll still do a lot of hands-on with the McKenzie method, and then I get my client to do the exercise or movement themselves a number of times in the clinic room to make sure that their pain does centralise and go back into the spine, and then their movements do improve. And then I teach the client how to help self-manage their pathology, or maybe it's not a pathology, it just needs to move, it's just so stiff, mechanical, and how to manage it well, so they can look after it down the track and don't have to rely on someone like myself. But I try and see them between 3 and 5 sessions, probably more close to the 5, just so I can get those good outcomes and to make sure we're on the right track. But everyone responds a bit differently. Had a few cervical spines come in recently with with some lower disc issues that radiate below the elbow, just getting really good results with those. Then I've got the clients with just very stiff and can't move properly due to the joints are so hypomobile, due to a lot of contracted soft tissue and just stiff joints due to lifestyle factors. So it's just getting them to move properly and educating them. But no, it's all going really well at the moment. So we've had a couple of tricky ones recently, but we've got there, which is really good. And I use a model called the mechanical model, which is you just look at your client's symptomatic response. So be like, Dave, are you better? Are you the same? Are you the worse? And we look at your mechanical movement to see if that's improved. So I don't use a lot to do with a pathoanatomical model that uses a scan, because as you know with the latest research, there's a lot of population out there, the asymptomatic population, that do show pathologies are on a scan but have no signs or symptoms. So I focus on treating the client, not the picture. But we don't exclude the picture, just in case we need to maybe go down that track later on. But even latest research says it's probably best not to go straight into scanning straight away, unless we're trying to rule out like red flags, or we've had a traumatic accident and we want to rule out things like fracture or like so. But we don't discard it because we might need to investigate them a little bit down the track. Yeah, so I find the myotherapy and McKinsey go together here really, really well. The association has designed this great brochure that's going to go into every local GP practice all around Australia, and it's going to be so valuable. And I think it's a critical breakthrough, I believe, as well. And I think it's important that the medical association become aware of myotherapy massage and the benefits behind it as well. A lot of people benefit so well from it, and so I think this is just the start, off the beginning, which I think is going to be fantastic. And it's pretty exciting news as well, to hopefully become maybe a bit more mainstream as well. And plus it gives their GP maybe some other options too, and so they can maybe look at the client's history and then go, well, maybe you are more suited to myotherapy or massage, and of course the other modalities that are out there as well. So very exciting days, exciting times. So I'm looking forward to see sort of what happens from here. And so, and I've been very lucky. I've had a couple of clients actually already referred to me from a practice in Preston, because I'm based out in Coburg East. It's just around the corner, and that's through the pamphlets, which has been fantastic. So yeah, very rewarding. And I look forward to more referrals down the track, which is very important, and that word of mouth to start to spread. So good job, Massage Myotherapy Australia, well done. My tip for you, if you're just staying off in the industry, whether it's massage or myotherapy or something very similar, you've got to look after your body from day one, really, really important, and that's the whole body. Not just these magic things, you look after those. So when it comes to the hands and the fingers and thumbs, you save them. You save them for delicate areas like cervical spine that you do need those thumbs or fingers. Try and use more your palms or your forearms and bigger, broader areas of the body, as long as it's safe for the client, of course, and for yourself as a therapist. And your body position, that's a crucial one. Use that lunge position lots, like where you can sort of anchor your front leg against the table, so you can sort of pivot from that hip, and your power will come from the hip area. Good posture in your lower spine. Keep a neutral spine, which is just your normal curve, your lordosis. Because as Professor McGill's proven, if we keep a neutral spine, your spine's up to 45% stronger in absorbing compressional forces and shear forces, which are two of the most damaging forces for the spine. So that would be my biggest tip for you straight away. Also, make sure that you do a bit of warm-up before you start treating clients. Some basic stretching, just to loosen things off and to open you up a little bit more. And when you are working with clients, as well as keeping a good posture through your lower back, keep the chest nice and open too. So we're not rounded in, we're nice and open while we're working. And remember, you don't have to always look down on what you're working on. You can always sort of look up as well. And I say that too because if you keep looking down, imagine you're doing this and you're treating for an hour and you're seeing lots of clients per day, and you're looking at the client the whole time while you're treating that part of the soft tissue. Sometimes that might create a neck problem maybe if we're sustaining this posture the whole time. So don't have to sustain that posture the whole time. We can sort of just look up at the same time as well. So for example, would be if I'm treating someone and I've locked my elbow and treating them and I'm looking down the tissue like this the whole time, there's no need to do that because the tissue's not going to go anywhere. So we just got to, and we use this to feel what the tissue's doing, and we use these to feel what the tissue's doing. So that'd be my sort of biggest tip straight away. Look after yourself, basic stretching just to maintain good posture. I'd probably do some form of resistance training just to make sure we keep nice and strong in areas we need to keep in.
Only uncover the side you are about to massage. The draping should already be lying in line with the PSIS and securely tucked into either side of the waistband of the client's undergarment. Hold the draping at the opposite hip with one hand, whilst the other hand draws the draping and the undergarment downwards to uncover the upper gluteals. On completion of the gluteals massage, re-drape to cover the entire back and shoulders.